everybody. This is Hoi-san Young, CIO for Oasis KSJ. AI and technology are flying across all this drug discovery and making the treatment more personalized and more targeted. And within this space of oncology, cancer, and the obesity and the cardiometabolic, what do you see are the main drivers and tailwinds may encounter?
I think things that are common for both, right? For sure. We talked a little bit about the biological, drivers that should hopefully sustain a multi-year period of innovation, which is as a whole positive. We've talked a little bit about that, but we haven't talked about some of the other sort of the non-science drivers. I think one of them is M&A. If you analyze a lot of the strategic or so-called large, or they call it big pharma, but they're strategic players in the industry that invest a lot of capital in development, clinical development of new drugs. A lot of these companies are facing looming patent expirations in the next several years out into the end of this decade. And as such, that potentially makes an investment in these type of themes timely in the sense that we do focus quite a bit on small mid-cap companies that could potentially be acquired. If you have conversations or hear them publicly, a lot of these large companies do not believe that they can completely do all of their innovation internally. They will have to source externally. And two of the very much important areas of focus are cardiometabolic / obesity and oncology. And so I think you'll see M&A being a very important theme. And if you look at valuations, very much as a whole, on an aggregate basis, healthcare, if you look at the S&P healthcare sector, which is one way to look at the sort of aggregate of healthcare companies, it's trading at roughly a 10% discount to the market multiple on a forward PE basis. In addition, a lot of what we focus, again, is on small mid-cap biotech, and they've come out of a multi-year bear market. And normally you see companies in biotech trade in line with the tech sector, right? So I think when I'm thinking about this is I'm thinking the starting valuations are attractive, the fundamentals are sound, there are catalysts like new product cycles, pipeline events, as well as M&A to hopefully drive returns, and hopefully, an investment in this area sort of complements, the excitement going on and the NVIDIAs of the world. So just to wrap up, we've got some similar tailwinds from the research and development side. We talked a little about demographics in common. And M&A is also important. Now, on the negative side, I think one of the risks to investing that's very much is healthcare policy risk. In my background in health economics has served me well navigating business cycles of different reform policies. And I think it's important to appreciate there is risk to, you all have to, we monitor this very carefully from a bottom-up perspective and a top-down perspective, drug pricing risk, et cetera. But, I think to mitigate a lot of that as well is to really focus in on transformative therapies, look at the clinical data, make an independent objective evaluation, invest in companies with differentiated clinical data that change standard of care. Those companies tend to win and have better pricing power in general. But these are generalizations, but very much it's a idiosyncratic company by company situation. But those are some of the things that I point out to from the positive and from the negative side.